About 40 million Americans are struggling with anxiety. 40 million, and a large number of them have already tried medications, therapy, supplements, and lifestyle changes. But they're still anxious, still wired, still waiting for something that actually works. There's a treatment that most doctors aren't even bringing up when they talk about anxiety. It works on a completely different brain system than the medications you've likely tried. And for certain people, it can start working within hours of the first dose, not weeks. It's also a nasal spray, not a pill. Today, we're focusing on Spravato, esketamine, what it is, how it addresses anxiety differently, who it helps, and a key mistake that can limit results. I'm Dr. Ayer, quadruple board certified psychiatrist and anxiety expert. Quick story about a patient I'll call Claudia. 51 years old, she had been on 5 different antidepressants over 4 years. Some helped a little, most did nothing. Her depression was somewhat of a struggle, but it was her anxiety that was truly running her life. She couldn't sleep, couldn't stop the racing thoughts. She'd wake up every single morning with that tight, dreadful feeling, worrying herself sick about any and everything, constantly feeling on edge, wired but tired. We tried something different, and after her second session, she said something I now hear all the time. It's like someone finally turned the volume down on my worry. We'll return to Claudia's story in a moment, but first, let's look at why so many people are still stuck. Now, here's something most people struggling with anxiety don't realize. The most common medications used for anxiety, SSRIs like Zoloft and Lexapro, target one brain chemical, serotonin. And serotonin matters, but it's only one piece of a much larger system. For millions of people, targeting serotonin alone isn't enough. The anxiety persists, their nervous system stays locked in overdrive, and their doctor's only move is to try another medication that works the exact same way and expect a different result. This is the anxiety treatment gap, and it's why so many people feel failed, not because they're broken, but because no one has yet addressed the right system. Soon I'll reveal the system's Spravato target and why it could be the missing piece for those who haven't found relief. So, what is Spravato? Spravato is the brand name for esketamine, an FDA-approved nasal spray that works completely differently from any antidepressants you've likely tried. It's a refined version of ketamine used as an anesthetic since the 1960s. And here's where the story gets interesting. Back in the 60s, doctors started noticing something strange. Patients who received ketamine before surgery reported dramatic improvements in their depression and anxiety. Improvements that lasted weeks after the drug had completely left their system. That led to serious research, and what scientists found was this. Spravato doesn't just work on serotonin like SSRIs and SNRIs do. It works on glutamate, your brain's primary communication chemical. Glutamate is how your brain cells talk to each other. It drives learning, memory, and emotional processing. When the glutamate system gets dysregulated from chronic stress, hormonal shifts, inflammation, or years of metabolic wear, the brain loses its flexibility. It gets stuck in patterns it can't escape. Spravato, esketamine, acts directly on that system, triggering your brain's innate ability to form new, healthier connections through neuroplasticity. Now, I want to be completely clear. Spravato is not FDA approved for anxiety. It is approved for treatment-resistant depression in adults who have tried and failed at least 2 antidepressants. So why are we talking about it for anxiety? Because this is exactly where the clinical observation gets fascinating. And what I'm about to show you explains why Claudia got better, even though this medication was not specifically made for anxiety. Here's the clinical reality. Depression and anxiety tend to co-occur. The majority of people with treatment-resistant depression also tend to have significant anxiety. In fact, studies show that up to 75% of people with major depressive disorder also have a comorbid anxiety disorder. During the Spravato studies, researchers tracked anxiety as a secondary outcome when treating depression with Spravato. What they found was consistent. As depression improved, anxiety improved alongside it, often meaningfully and quickly. Studies show a response rate of 60 to 70% when Spravato is combined with an oral antidepressant. That means 6 to 7 out of 10 people experience at least a 50% reduction in symptoms. And here's what separates Spravato from everything else. Those improvements can happen within hours to days, not 6 to 8 weeks like with traditional antidepressants. Is there dedicated research on Spravato for anxiety as a primary diagnosis? Not that I'm aware of, but a recent systematic review found several studies investigating ketamine for anxiety. For now, though, the strongest current data comes through the depression trials, where anxiety improvement shows up reliably as a secondary finding. For Claudia, after her second session, her racing thoughts slowed, the morning dread faded, the excessive worry subsided, and the muscle tension eased off. Now, I want to tell you why Spravato may work especially well for adults in midlife, because there's a biological reason for this. This may be the most important thing in this video for any man or woman navigating midlife. During perimenopause and menopause, estrogen decline doesn't just cause hot flashes. It directly disrupts the glutamate system, the exact system Spravato targets. For men, years of chronic stress, declining testosterone, and metabolic changes create the same pattern, glutamate dysregulation, that serotonin-based medications like SSRIs may not completely address. This may be one of the reasons your medication could work for years, then suddenly stop working. And sleep makes everything worse. Poor sleep drives glutamate dysregulation, which amplifies anxiety, which destroys sleep. If you're caught in that loop, download the free sleep guide in the description below, because sleep is foundational to any treatment working, including Spravato. So who is Spravato actually right for? You're a good candidate if you have treatment-resistant depression and have tried and failed at least 2 antidepressants. A diagnosis of anxiety is not necessary, as many people with depression also experience anxiety that can improve as depression does. Avoid Spravato if you have an aneurysm, arteriovenous malformation, a history of brain bleeding, or an allergy to ketamine. Also, not appropriate for uncontrolled high blood pressure or active substance use. Important medication interactions include benzodiazepines, opioids, and stimulants like methylphenidate. Always disclose every medication you take before starting. Treatment is done in the clinic only, never at home. You'll have to avoid eating for 2 hours before and drinking fluids 30 minutes prior. You're monitored in the clinic for 2 hours after each dose. No driving is allowed until the next day after a restful night's sleep, meaning you'll need to arrange transportation to and from your treatment center. The schedule is twice weekly in month 1, once weekly in month 2, then every 1 to 2 weeks for maintenance. Most insurance plans cover Spravato since it's FDA approved, but prior authorization is typically required. Your treatment center will help navigate that process. Now, here's the part almost no one talks about, and it's the reason some people get transformative results while others see only modest improvements. Spravato is not a magic bullet. The biggest mistake I see is people getting treatment in isolation without addressing what made the anxiety treatment resistant in the first place. Here's what you need to understand. Spravato opens a window of neuroplasticity. After each session, your brain is temporarily more flexible, more capable of forming new connections and breaking old patterns. Think of it this way. Spravato loosens the soil, but you still have to plant something. What you do during that neuroplasticity window, prioritizing sleep, nutrition, therapy, stress regulation, and movement, directly amplifies your results. Claudia didn't just do Spravato sessions. We optimized the sleep, addressed her gut health, continued therapy, and worked on a stress load. That comprehensive approach is what made her results even better and why she's still doing well today. To learn more about the root causes of anxiety and how to improve your mental wellness, check out the next video.